Hello everyone, welcome to Derana BIZ 24. As you are aware that throughout this program we've been talking to different industries. But you know, since recently we've given a lot of importance and priority to the education sector. And today, especially, we're going to talk about the healthcare industry. As you know, with the rising global demand for healthcare professionals, we thought, why not talk to the professionals of the International Institute of Health Sciences, which is none other than, we call it IIHS. To have this discussion, we have with us Dr. Kitsiri Edirisinghe, CEO, co-founder of IIHS. Hello to you, Doctor.
Hello.
And along with him, we also have Dr. Dinusha Kanativela, Head of Academics at IIHS. Hello to you as well, Dr. Dinusha.
Hello.
So to start the conversation, as we all know, the rise for the healthcare professionals keep on increasing in the global context. But before we touch upon that, Dr. Edirisinghe, I would like to start upon to talk about the education system in general. What is your point of view? Because the demand for education keeps on rising, and with the ongoing economic situation in the country and also with the post-COVID situation, now the parents and the children are at this juncture of deciding whether to study in Sri Lanka or to go abroad. Now this is a big question everybody has. I think this is something we have to clarify at the start of the program itself. So what is your view about this?
It is very timely question, and which lingers on almost all the parents these days. Now if you look at the Sri Lankan education system, we have a state sector and we have a private sector. If a student or a candidate wants to work in the government sector and settle down in Sri Lanka, they should do better and get better results in A-levels and can go to the government sector, because there's no migration from the private sector to the government sector. So it's once you have a government sector qualification, you can definitely work in the government sector. The other option is, since there are limited space in the universities or the government universities, so they have only a handful of people can go into this, and the top notch can go to the government sector, government universities. So therefore they have to opt for the private sector. Now what are the private sector universities that we have? We have two different kinds of universities. One is UGC recognized, university grants recognized, they deliver local programs. So those local programs, and also they have the opportunity to get the loan scheme. There is a interest-free loan scheme. That's a very good option for the today's climate. Then there is another group that provides a transnational education. So what they do is they get a university, foreign university qualification, they deliver in Sri Lanka. So all that is, these three areas are there. So what a parent or a student should look at, what do you want to do at the end of the day?
That's right.
Are you going to work in Sri Lanka or are you going to go out of the Sri Lanka? So some would say we have a brain drain, we shouldn't allow kids to go out of the country. But I have a different perspective of this, because if our per capita income now, our per capita income is $4,200, somewhere around. So with that, the opportunities you have to do a job in Sri Lanka are limited. So, and then you should allow people to go out of the country and then work and earn and send that money back to Sri Lanka. So that's, we have to give the opportunities for our youth. Right. So therefore, if there's opportunity, always they can grab an international qualification either in Sri Lanka or outside. They can go. So all depends on, when you look at the international qualifications, if you do a total program in foreign countries, it costs you about roughly around 100,000 US dollars or Australian dollars. So it amounts to about 10 million rupees. So if you have money, if you can afford it, if you take the risk, you can go. You can send them from the scratch, or they can look at doing that total program in Sri Lanka. So generally, when you have a transnational program done in Sri Lanka, it's about almost 40%, 30 to 40% cost you will have to incur. It's a lot of saving. And then they can go to jobs.
Yeah.
The other way is that they can do a part of the program in Sri Lanka. You go to the final year in X, Y and Z universities. Those options are there. So all depends on the amount of finances that you have, and also what is the outcome end of the day, where do you want to reach at the end of the day.
That's interesting. Now, that is your point of view as a general educationist. Now, I would like to bring you to talk a little bit about you being the CEO and co-founder of IIHS. Now, IIHS is the pioneer in healthcare education in Sri Lanka, and for over 2 decades, you have been maintaining your high-quality education system in the healthcare industry, the education. Now, what is this whole concept of IIHS? Because it is also considered as the International University Learning Center. So, let's talk a little bit about this as well.
Yes, IIHS was founded 20 years ago with a wave to look at exporting skilled labor. So, we looked at as a nursing school. We started at the nursing school, still we are. Simply because we looked at the industry and we deliver programs. We are very close to the international industry as well as a local industry if there is a need. When you look at international healthcare industry, it's burning. Pre-COVID, there were issues like population aging, new diseases, climatic change, all that affects health. So, there was a massive demand. Now, post-COVID, what happened was they closer to the consumer, the service provider closer to the consumer, all this industry is disrupted. So, if you take at the top of the list, healthcare, because we are very closer to the patient, so it all disrupted. With the disruption, there is massive job demand has created. For example, today you need about 15 million nurses today, and there is another physiotherapist you need because there is a lot of disability and other physiotherapies are needed. And then you need research because we are living today because of the vaccine that's contributed directly by the biomedical scientists. So, there's enormous amount of jobs there. And also with this all these problems, your mental state has to be there, not physical state only. So, you need psychologists to manage these counteracting today's burning issues in the society and families and the personalities. So, therefore, psychologists are needed. And then on top of that, we see many disasters, isn't it? Man-made disasters, natural disasters, and then so many road traffic accidents. There is a lot of trauma. And then because of the aging population, there is emergencies created. So, you need emergency medical technicians or pre-hospital care workers. So, those are the things currently we are looking at. And we proudly say that we are a healthcare institute because there is a massive demand, and then no sooner you complete your program, you get a job. So, we have a 100% job guarantee soon after all the programs that they do, and about 24 years, if you can earn about $5,000, that close about ₹1 million a month, and then the perks that you have and the recognition that you have in the world, I think people, youth and the parents should really look at this area very seriously.
That's right. Now, just a cross question, Doctor. Is there any specific reason that you are sticking into the healthcare education system?
Simply because of the world demand. Today, all the health systems are struggling without doctors, nurses, and the other professionals. And we looked at the nurses and the allied healthcare professionals because it's a shorter span. To become a doctor, you need about 6 to 7 years. When you start practicing and you settle down, it takes almost about 10 years.
That's right, yeah.
Even in locally or foreign countries. But in 4 years, if you can do the same thing or somewhere comfortable with your finances, I think we are sticking into this particular segment is that give a better outcome in short time. So, what in financial term, you get a return on investment in no quick time.
Interesting. Coming into Dr. Dinush, I would like to ask you the question, do you think an international qualification is important to a student in Sri Lanka, and if so, why is it important?
Yeah, so these days I think we can see many students are dreaming about going out of the country, not only students, even the parents, to go out of the country and to get sustainable jobs. For that, the main requirement would be their qualification.
That's right.
So, if someone is trying to get a qualification and trying to get it validated later by a different country, it will not be very easy. Rather than that, a student can obtain an internationally recognized qualification from the beginning after their A-levels. So that is why we are bringing programs from first world countries. We are working with universities like Cambridge University from UK, from Australia, universities like Deakin, James Cook Universities, and also from Finland, University of Metropolia. So if students can have an internationally recognized qualification, going across the world is not a dream. They can travel anywhere. In addition to that, with the dream of going out of the country, definitely they should have an orientation to different systems. Especially if they are interested in healthcare field, if they are moving from Sri Lanka to another country, there can be certain differences in the system. In that case, if they don't have proper orientation, definitely they would struggle. It's not only about the system differences, they might face different types of other challenges. Cultural differences, financially there can be problem, academically, and they can be struggling with communication skills in English. So they have to face different types of challenges if to become a global citizen, which we can talk later in detail.
For sure,
So that is why we see they need a proper orientation. So if they can follow an international program, this orientation would be provided in a better way. In addition to that, the cost effectiveness. So the parents must be thinking to get an international qualification, which would cost a lot for a parent. But that is why we have introduced different modes where the student can get the exactly recognized international qualification with a very low cost or a affordable cost. So the same qualification parents can definitely afford, but the student might get a highly recognized qualification from an international university.
That's interesting. Now we're talking about starting off your international education system, like from Sri Lanka. Why not start here and then pursue it to go abroad or so? Now, since we touched upon the global citizenship, we will talk about that soon after this break. Welcome back after the break. Before the break, we were in discussion about the International Institute of Health Sciences and the importance of following an international qualification for a Sri Lankan student. Now, before the break, Dr. Dinusha touched upon the importance of becoming a global citizen. Now, I would like to get an elaborate answer on this from Dr. Kitsiri. Now, whatever the industry or whatever the education that a student wants to follow, maybe healthcare, maybe engineering, anything. At the end of the day, when it comes to pursuing a job, there is a set of skills that any job that requires. We talk about, cultural, how anyone can adapt to any culture, agility, and then soft skills. How does IIHS go forward in creating this global citizenship to the students of IIHS?
Yeah, the global citizenship in a short term, a short description of global citizen is that the people should be responsive and respect certain elements.
Right.
So you can respect, not only that, but you have to be responsive. So what are those? Respect and responsive for people, the culture, colleagues, professional, and to yourself.
Oh.
So then, because every problem now are global, nothing is local. You said COVID is a great example. So healthcare professionals will have to get ready for anything. So we train them. What we do is we take them in, say there's an inclusive culture, because you might have to want to do something, but for suddenly you don't have finances. So we give subsidized education, and also we give financial support by loan schemes. And the second one, academically you are not inclusive. Your A-level results are in X, Y and Z. You are not suited into this. But we have nice bridge to get them in. So we include anyone. So there is no restriction international education for X, Y and Z. So we do that. And second thing is we have to make this very enjoyable. Otherwise they will not respect or respond. So we create an environment where it's very conducive. Academics is just a part of the thing, day-to-day life. We create that and make them enjoyable with the other activities. We have activities of curricular and co-curricular activities where they have to participate in different, we have about 5 committees focusing on different activities. So they automatically develop their responsiveness and the respect for X, Y and Z. So that's what we do. And finally, all our programs are outcome oriented. They have to create their global citizen at the end of the day. So we transform them and we closely monitor them other than the academic activities, which will be very enjoyable as I told you before.
Yeah.
So that has done well. We have over 600 youth working all around the world. We can proudly say, and they are they're supporting their parents, they're supporting their colleagues, and we be very responsive global citizens there.
Amazing, amazing. I mean, I am fond of what you said. None of the problems are local nowadays. It's all global. So it's all about, getting ready to face the global issues and solve them. So that's pretty amazing. Now coming into Dr. Dinush, I would like to ask, what are some of the international programs that you deliver at IIHS?
Yeah, so being a healthcare training provider, we bring a range of programs, especially on the healthcare area.
Yeah.
So for the students who have done A-levels, they can go for a bachelor's program with us in the areas of nursing, biomedical science, physiotherapy, and also we will introduce psychology and pre-hospital emergency care bachelor's program. So all these areas, all these programs are affiliated with highly recognized universities, which I mentioned earlier as well. We are working specially with Coventry University from UK, highly recognized university, and almost all the programs have pathways to University of Metropolia in Finland and many pathways to Australia. We are working with Deakin University, James Cook University, and especially for biomedical science, we have a range of universities in Australia. So based on the student preferences, they can go for different areas under the field of health.
I think now it's the right time also to talk about the intakes at IIHS. What are the intakes that are going on for this year and upcoming?
Exactly. So there can be certain students who have sat for A-levels, probably waiting for their results. So if they have done A-levels in any stream, they can definitely apply for these programs. And in case of any results issue, there's an option for them as well, because we offer foundation in biological science programs in order to, if they have some sort of a problem in their advanced level program. Now, looking at the programs that we offer, there are two modes that the students can apply. One mode would be student can start their program with IIHS in Sri Lanka, and after 3 years they can go out of the country to one of the universities that I mentioned earlier to complete their bachelor's in that particular country, so that they would get their registration as well in that particular country. The other mode is, if there's a parent who's willing to let the student go right now, they can get the students to complete the entire bachelor's program in Sri Lanka itself. So within a time period of 4 years, they can complete the entire bachelor's program in Sri Lanka, where they can apply for a master's program later and go out of the country one day.
Interesting. I think now it's all about making that decision to get started in the country itself without wasting a lot of time thinking, should I go abroad? What qualification should I follow? You have information right here. And those information goes out to everyone who's watching. If you are a parent, or if you're a student, or if you know somebody who wants to follow, please carry the message. Now, with that, Dr. Kitsiri, before we come into a closing, I would like to ask this question. What is this IIHS Multiversity?
It's an interesting project we are envisaged a couple of months ago. We are creating a facility where the many universities will be under one place. And it's a very sustainable project which is located in Kerawalapitiya, Valisara. And now our partner universities and us, we thought we should give these opportunities what we have given to the local community to the regional students.
That's right.
So if you really look at our region, we have nearly over 100 million youth seeking for higher education. They also they have the same problem. Either they don't have the inclusion by finances, they don't have enough finances, or they don't have the proper academic qualification to get into. With our experience of 20 years, we are opening doors for the regional students also to go through these pathways. But the numbers that are needed in first world are enormous. Like for example, UK, you need 50,000 nurses, Germany 80,000, USA about 1 million. We can't supply that demand from the local community, our students. So we should allow the others to come in. So we basically want to create a very conducive environment where people can come and learn and then go to X, Y and Z countries where they get the green pastures and then a good life and be a global citizen.
That's definitely an interesting concept, and I wish all of you all the very best for the upcoming concept as well. Along with that, ladies and gentlemen who are watching us right now, we have come to a closing. But before we close the session of today, I would like to remind you to get in touch with the International Institute of Health Sciences, which is IIHS. You can get in touch with them if the physical address is number 704 Nigambu Road, Valisara. That's where they are located, and you can contact them through 011 465 1144. Let me repeat, 011 465 1144. That's the contact number. With that, by bringing this program to a closing of Other Derana BIZ 24, thank you so much, Dr. Kitsari Edirisinghe, the CEO, co-founder IIHS, and Dr. Dinusha Kanativella, Head of Academics at IIHS. Thank you so much for joining with us, and we will hopefully meet again to have another fruitful conversation through Other Derana BIZ 24. And thank you so much for joining with us as well. Keep in touch. We will come back to you soon with another program.